A certain pain that shows up in your joint is one of the most underdiagnosed causes of your low back pain. Today, we're talking to a local neurologist who will explain what triggers this pain and what are the treatments. With more on this, local neurologist Dr. Chad Domingue and pain management expert with the Avila Physician Network. Thank you so much for joining us.
Good afternoon. Hope all the parents are having a good first week back to school with all the kids. It's fun times in my house.
Yeah, some good wishes there. So what are the symptoms that you're suffering from lower back pain linked to SI joints pain?
As we always do, let's start with anatomy so people understand what a SI joint is. I have a model up here for us to look. SI joint is in our pelvis. It's kind of where you put your finger in that mid part of your butt when you have that pain. So it sits, obviously this is kind of that butt bone right here. An SI joint is a stabilizing joint. So basically it transmits the force and the weight of our upper body to our legs. It has a front and a back. It's a die joint, so just two-sided. Looks kind of like an ear, and it doesn't have a lot of mobility. It's more mobility in a female, obviously for pregnancy, but in a male, it's more of a stabilizing type joint. This joint can have dysfunction just like any other, and there's a lot of nerve endings. You can see these little holes. These are the sacral holes, and these sacral nerves send branches over to the joint. So because of all those nerve endings, when you have a problem, it can be very, very painful.
And what are the symptoms you'd feel?
So SI joint pain can mimic a lot of things. It can mimic back pain, butt pain, thigh pain. It can be painful with any type of maneuver, sitting, standing, walking. Again, because it stabilizes our upper trunk. Whenever you're going like climbing, for example, whenever you put that first step, you're putting pressure on your SI joint. It can radiate to your hip, your thigh. But when I look at SI joint problems, and you can kind of see on anatomy how close everything sits together, you know, here's your hip, here's your SI joint, here's your facet joint. These things can mimic each other. So the first thing when I deal with people with back or butt pain is we're trying to look specifically as to what's causing this problem. But in general, these people sit to one side. They hate, you know, kind of making their legs in a frog position. They hate going upstairs. That's the typical symptoms.
So what are the treatments available that you would recommend for this?
You know, we talk about SI joint problems is no different than any other joint problem. So you start with the simple stuff first. Heat, ice, anti-inflammatories, you know, topical creams, TENS units, stretching. Physical therapy and chiropractors are very important here because they can allow maneuvers of the joint to keep movement, and they can also do things to help strengthen the joint. So there are specific exercises in the pelvic muscles to help strengthen and support it. There's an SI joint belt. So it's a very small belt, not as big as a back brace, but a very small belt that will support it. When those things fail, then you're in my world. What do? Well, we do injections, steroid injections, stem cells, a possibility. We can do a procedure called a rhizotomy where I can have a needle here that heats up at the end, and I place this needle on the outside of that joint, and I burn all those little nerves you and I were talking about to make it so you don't feel the joint.
Right.
At the end of the day, if all that fails, the next option is to do a fusion. This is a screw, and that's literally what they do. They screw on the outside. You see a lot of people with SI joint problems that had previous lumbar fusions because the force has to go somewhere. Leg discrepancies, pregnancy, obviously we mentioned, trauma. I see a lot of car accidents, people get SI joint problems. But it's really important, especially with the lumbar fusion, that people understand that the force does have to go somewhere, so SI joint problems can certainly be associated with that.
Thank you so much, Dr. Chad Domingue, for bringing us some good answers on that. Appreciate it.
Absolutely. Always a pleasure. You guys be safe.